Welcome to my podcast. Today I'm going to talk about another case. It's basically about abdominal pain in general. So after you introduce yourself and double check the patient name, date of birth, you'll ask the patient, how can I help you today? So the patient will say, Doctor, I'm having pain in my tummy. So tell the patient, can you tell me more about it? So the patient will say, I'm having pain in my tummy. It's been for a while, and I don't know what should I do about it. So we just need to think about the case basically if it's acute, sudden, or it's a chronic and recurring. So basically, you need to think about the ninth quadrant of the abdomen, and accordingly, you will decide which differentiation you could think of. So you will ask the patient, "Can you put your finger exactly where the pain about?" And on a scale from 1 to 10, how would you rate your pain now? Where 1 is minimum and 10 is the worst pain you could feel. And also ask about the characteristic of the pain, if it's crumbly, if it's dull, if it's stabbing, if it's pulsating, if it's colicky, if there is any trigger, for instance, like food, if it's relieved by, for instance, flatus, farting, eating food or drinking milk. You will ask if there is any associated other symptoms, like, for instance, feeling nauseating or vomiting, if there is diarrhea, constipation, passing blood, black stool, if there is any bumps and lumps, if there is any noticeable weight loss. So all of that will give a hint and a flavor about what's going on, basically. And you will ask the patient if he had done anything about it, if he had taken OTC, or if he had seen any doctor. Because basically patients sometimes they try stuff and then if it didn't work, they will come straight away. And you will also ask if the pain goes somewhere or if it's only staying in one place. If it's, for instance, aggravated with eating fatty meal, for instance, this might point out to acute cholecystitis. If the pain, for instance, on the right iliac fossa and started with the umbilicus, this might make us think about appendicitis. If the pain goes from the loin to the groin, this will hint to the kidney issue and stones. Also, if the patient is a lady, you'll ask for the last menstrual period, and you need to rule out any pregnancy if the woman is in childbearing age. Also, if the patient is elderly, you will ask if the pain goes to the back, if there is too much pain, like tearing. So you might think about aorta, aneurysm, rupture aneurysm. If the patient has history, for instance, of pain which is recurring and relieved only when he opened his bowel, this might hint us to irritable bowel syndrome. If there is any blood, for instance, this might, and if it's recurring as well, and there is other associated sign and symptom, this could be pointed to inflammatory bowel disease, Crohn and ulcerative colitis. If there is any pain, as I say, in the loin to the groin associated with burning in the wee, so this could be UTI. If the patient says, I didn't open my bowel for some time, I'm feeling like distension, gases, so it could be constipation. If the patient says, I'm having a black tarry stool or seeing some blood, so this might point on our mind thinking about peptic ulcer or duodenal ulcer, and maybe problem down below like piles, anal fissure. Also ask if there is any difficulty in swallowing, dysphagia. So this might also point out to something else. So all of that you need just to inquire about, and if there is anything that doesn't seem right, You will ask the patient if he had any thought or ideas what's going on, and if he think that there is any link to the symptom, then you will ask about the past medical history. If there is anything relevant, any medication that he's taking on the long run. Some patients might take, for instance, ibuprofen on the long run for certain pains, and then they will start all of a sudden acute abdominal pain. This could point to perforation, of course. And also, after you asked all of that, you will ask if there is if any other member of the family had the same pain, or if it's acute, associated with nausea and vomiting. This might point out to bug or food poisoning. So you'll ask if there is any other family member with the same symptom. Also, you will ask if there is any family history of any unknown disease. Also, don't forget about when you ask about medication, any allergy. Then you can just swiftly about lifestyle and what work they do, and if there is any stress, for instance, involving life. This could relate to, of course, irritable bowel syndrome or ulcer. And then you will ask the patient, I would like to have a look and examine you. So check the observation, then the tummy. And don't forget about BR with any abdominal examination. And of course, you will provide a chaperone in those kind of examination. And then you will arrange for certain investigation that might be needed. And then you will agree with the patient according to the differential you come up in your mind, and agree with the patient about the management plan. And always safety net the patient. So you will say if he did not improve, if there is anything doesn't seem right, if your condition get worse, if you feel that there is other symptom which has started and your condition is not improving at all, you need to come back again or go to the A&E immediately. So by that, I hope that I covered most of the issues around abdominal pain and how to tackle it effectively and efficiently in timely manner. Thank you.